healthcare leaders and clinicians are excellent problem solvers. So that's their go-to. They do it automatically. To them, when you present an issue to them, man, they're tying their shoes. They know how to do it. But what they don't recognize is when they're actually dealing with a problem that's not a problem, it's a polarity.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management at the Naveen Jindal School of Management. Here at the University of Texas at Dallas, we bring together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare ecosystem. I'm Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management. Be sure to subscribe on Apple Podcasts, Spotify, or your favorite podcasting app to ensure you don't miss any of the future episodes. You can also join us online at businessofhealthcarepodcast.com. I must start this podcast by saying at the Naveen Jindal School of Management, we have faculty, facilities, and degree programs that are dedicated to healthcare leadership and management with offerings for undergraduate, graduate, and executive education. So it's irresistible to invite today's guests who have spent their careers helping to create healthy, healing organizations with thriving, resilient, and unstoppable healthcare leaders. Join me in welcoming Tracy, Christopherson, and Missing Troseth to the Business of Healthcare podcast. Welcome, ladies.
Thank you.
Thank you very much. It's great to be here.
Yes.
Well, it's unusual that we have two people as the guests, but I kind of like this. I think we get a double return on our investment here with both of you. As I mentioned in my opening comment, leadership is one of the most important terms that we try to express and define with competencies. And the subject of leadership is broad and it has many dimensions. So let's try to cover some of these important aspects today. I think you both might be inseparable. So let's start by getting your story out to the audience. Your company is named Missing Logic, and you have a podcast by the same name.
Right.
Yeah, this is Michelle, and thank you so much, Bob. Our podcast is Healthcare's Missing Logic podcast, and you're exactly right. The name of our company is Missing Logic, and we'll tell you a little bit about how that came to be. But first of all, I'll tell you a little bit about myself and have Tracy introduce herself. And we're kind of a dynamic duo, we like to say, in how we work together and how we partner with healthcare leaders across the country. So I'm a nurse by background, and I have worked for many years in critical care and became a clinical nurse specialist for professional practice, and worked for many years across North America in co-creating these healthy healing organizations. So a lot of experience in working with leaders. And very fortunate to work with leaders that knew this was important work and wanted to partner with us to make that happen. And then over the years, began to work with different global companies. And my last role, I was the Chief Professional Practice Officer of a global company and left that role in 2018, actually 2017, and we started Missing Logic in 2018. And Tracy and I, we've known each other for over 30 years. And I'll let her introduce herself.
Yeah. Oh, it's just such a pleasure to be here today. And the one thing you have to know about Michelle and I is we met at hospital orientation over 30 years ago. It was one of those, stand up, shake the hand of the person behind you. That happened to be me. And we like to say we've been shaking hands ever since. And, it was a big auditorium. I'm a respiratory therapist by profession. And so Michelle and I worked together at the bedside collaboratively for years, helping care for patients. And then as our careers kind of grew, we stepped into different leadership roles. We continued to partner with each other and work together and led a lot of interprofessional collaborative practice efforts in the healthcare organization that we worked in. And we like to say we were doing interprofessional collaboration before it was cool, because right now it's a hot thing, right? But we were doing that way, way, way long time ago. And I was the director of interprofessional education and practice and worked in those organizations all across North America to help them create healthy healing work environments and interprofessional collaborative practice environments. And I'm a doctorate in interprofessional healthcare studies, getting ready to defend my PhD here pretty soon. So it's an exciting time. And in 2017, I left my role as well. And one of the things that Michelle and I, we've been doing a legacy plan for a long time. We knew we had something really great in us, and we wanted to make a difference, a big difference. So we took a little pause and we left our corporate roles, and we thought, what really is needed? And the one thing that we recognize is that in all the 30 years that we've been working with healthcare organizations and leaders, is they dealt with the same issues over and over and over. And we saw this pattern. And what we had learned is that those challenges they were facing weren't problems. And, they were trying to use a problem solving logic to solve them, but they weren't really problems. They were what we call polarities. And so we knew the difference we wanted to make was to bring this competency to healthcare leaders so they could stop wasting time and money and energy on problems they can't solve. And that is the missing logic in healthcare.
But I like the name. I like the fact that you are best friends also. I have one business partner that I met 35 years ago. We've done several startups together, and I feel the same way. I can collaborate, talk, share ideas anytime, day or night. And you can certainly sense that synergy. So that's good. I've listened to your podcast, and it reminds me of a famous podcast that was on National Public Radio, and it was called Car Talk. Car Talk had two brothers, Tom and Ray Magliozzi, and they had great information combined with bad jokes and uplifting humor. And I think I sensed a little bit of that on your podcast as well. And it was a joy to listen to that. So we'll get more into the details of this mention of Polarity Intelligence. We'll get a little more into the details of that in a few minutes. But I know that working the healthcare field, there's a lot of problems that need to be fixed. And one thing we have discovered is that doctors and clinicians, they're really skilled at solving problems. They know how to do that. And we tell a lot of our students, a lot of them, we have a program here which is dedicated to physicians, the Alliance for Physician Leadership. And when we talk to that class of doctors, we first mentioned that they have one standard deviation higher IQ than most people. They really do. But and they're brilliant. You talk about wearing a problem-solving lens. They wear that lens. But there's another dimension to this that we try to get across to our healthcare leaders, and it's really centered around emotional intelligence. And so I'd like to get your perspective on emotional intelligence and how polarity intelligence fits into that overall umbrella.
Sure, absolutely. Well, emotional intelligence is very important for leadership. It's that being just aware of your surroundings, aware of the people that you're with. And if you're an effective leader, that's absolutely critical. And we know there's a lot behind emotional intelligence. And what we recognized with polarity intelligence, there's a great synergy between the two, just the awareness and the relationships and the dynamics of how you interact with people as a leader. But polarity intelligence helps you see two interdependent pairs of values that exist in relationship with others, but also with the problems that you're trying to solve. And so it really brings forward, and what we're trying to do is bring forward to have it be an unconscious competence. So when a problem is presented to me as a leader, I don't automatically jump into my problem solving mode. I pause and I can see and ask myself, what am I feeling here? Is there a tension here? Is there another side to this issue that's presenting itself to me? And when I have that awareness, I have a whole different approach in how I go about managing it instead of solving it.
Okay. So, Tracy, why don't you give us a few examples so that we're crystal clear on what a polarity is? I have a few ideas, but I may be wrong. So why don't you try to give a couple vivid, and I'll see if I can't provide one as well.
Okay, that sounds great. One of the things that we do that I think everybody will relate to is we use a breathing methodology. So inhaling and exhaling is a polarity. When you inhale, you get the positive benefits of oxygen. When you exhale, you get the positive benefits of releasing carbon dioxide. It's a polarity your body manages all day long. You inhale and you exhale to sustain life. If you don't inhale and exhale, you're going to die. That's the downside of it. If I only inhale, I'm going to die. If I only exhale, I'm going to die, right? That is and there's a tension that sits between it. When you really inhale and you don't exhale, you start to feel the tension. That's the loss of the benefit of exhaling. If I exhale all the way and I hold that and I don't inhale, I'm going to feel a tension because I'm losing the benefit of inhaling and getting the oxygen. Our body is the only polarity managed for us all the time. Every other one we have to manage. But people kind of understand, oh yeah, that makes sense. If I inhale and I don't exhale, I'm going to die. Yeah, I get that. Same thing with the polarity. If I only do one pole, I don't focus on the other, there's going to be a consequence. Now, in a leadership role and leadership perspective, one of the significant tensions can be decision-making. So it can be participative decision-making and directive decision-making, right? So they go hand in hand. If we overemphasize one, what we know about polarities is when you overemphasize one of those poles or one of those values to the neglect of the other, you're going to end up at the downside of that, and you're going to experience negative consequences. Because they're interdependent and need each other, you have to have both to get to the greater purpose that both of them serve.
Very good. I seem to think when you talk about these polarities, there's always a concept of a conflict in place. And, we teach courses on conflict management and dispute resolution, on negotiation, and we try to get some skills underway to help people become mindful of these techniques, being mindful that conflict could be good, it's not bad, to kind of reframe the perspective of what a conflict is. And I'm kind of thinking here with your polarity intelligence, you mentioned the term unconscious competencies. And I think of my grandson, I'm trying to teach him to tie his shoes without thinking about it. He just reached down there and he's got this competency of tying his shoes and he doesn't have to think about it. And I think in negotiation and conflict management, we're trying to do the same thing. We're trying to build this into a mindset, somewhat of a part of your worldview, if you will. Is that the way you see polarity intelligence?
Yeah, and this is Michelle, Bob, and that's such a great point. And that's actually what Tracy and I are after and what we really believe is the missing logic and what is needed in healthcare. Just like you mentioned at the very beginning of our interview, healthcare leaders and clinicians are excellent problem solvers. So that's their go-to. They do it automatically. To them, when you present an issue to them, man, they're tying their shoes. They know how to do it. But what they don't recognize is when they're actually dealing with a problem that's not a problem, it's a polarity. And sometimes polarities are problems as well, but when we can get into that a little bit more. But we want them to just be able to recognize that almost immediately. And I will say there are some leaders that are natural polarity thinkers, or they have this polarity intelligence, but what we're finding is there's not a name for it yet. They don't even know what it is. And then how can we grow it and make it unconscious if we don't bring it to the forefront, which is what we're trying to do. And that tension is good. Conflict isn't necessarily bad. And we're trying to teach healthcare leaders that when they feel that conflict, they most likely are dealing with a polarity, and to pause and think, what is the opposite of what I could be dealing with? And is that also present in this situation right now? So that's what we mean about having it be unconscious. Just we begin to recognize them immediately that the tension is good, that we're dealing with this invisible energy between two interdependent pairs of values, and we can manage it, and it's not a bad thing. It's a good thing. It will help us.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
So when we think of bias, there's a lot of research that's been done on bias, particularly in today's age where everybody has an opinion and every opinion is shared in social media, et cetera. And it seems like people are very quick to make comments and statements about how they feel and think about things. And, when we start talking about that whole emotional intelligence, the very first step is our own self-awareness. How do we stop and think about how we're carrying on? How are we actually managing ourselves? And how well do we know ourselves? Do we know when to be quiet and when to talk? And I'm just trying to think in terms of the leadership skills necessary. Managers and others might jump right into a bias of how they think about things. How do you guide someone away from a strong bias into thinking about a polarity emotion tool that they can use?
Well, yeah, I think something to think about here is that it is that awareness. You hit the nail right on the head. It's really more about being aware rather than steering somebody away. I think what polarities do is it helps you to realize both poles are equally important. One is not more important than the other. Both are absolutely necessary. And what that does is even if I have a preference or a bias for, one of the poles, it helps me to realize that I'm not going to lose something by opening up my perspective to understand the opposite perspective. I'm actually going to gain something. And when we look at a polarity in that way and help people to see, wow, this is my preference. And I'm afraid, most of the time, I'm afraid I'm going to lose what I value. That's why I hang on to my pole so tightly and I don't open myself up to hear the opposite perspective. When I know both are necessary and my perspective is valued, I can open myself up to value the opposite perspective, and we can begin to understand how the two work together, and that we can manage these fears that we have about losing what we value in this relationship. Okay. And that's what helps to kind of recognize I have a bias. Everybody does. It's not a bad thing necessarily. It's, again, to your point, knowing I have it and how it influences how I'm engaging with others. And a part of Polarity Intelligence is healthy relationships and dialogue. And those two things are the things that support really developing this Polarity Intelligence, because we're more open, we're more able to communicate with each other and deepen our relationship and understanding of each other.
Yeah. So what I'm hearing here, Tracy, is that these are skills that can be developed.
Mm-hmm. Yes.
Once again, I see a common, maybe even a resonant here between dealing with negotiation and conflict management. Some of the skills they try to teach you in conflict is to, separate the people from the problem. That's a technique that you learn, or focus on the interests rather than positions. Mm-hmm. Sometimes it's just something as simple as to, create more options so you can see things differently. Mm-hmm. So from that perspective, do you have techniques that you train people how to become aware and put this to use?
Yeah, we actually do. We create based on work of Dr. Barry Johnson. He developed a polarity map to make it visible. So if you put it in the correlation to conflict management, if you help people identify what are the tensions, what are the two poles that we're dealing with here, you can also, in the mapping process, identify the greater purpose. And then you can just draw out what is good about both. And then from that, you can help them see if there's a loss of either one of those poles in the polarity map. And it makes it visible. And so that's what Tracy and I do with healthcare leaders, is we introduce them to these tools so that it makes it visible. And then a big part of the secret sauce is that you put action steps on both sides. And it's not a 50-50. You might be, for example, if you're dealing with directive decision-making and participative decision-making, which was a very big polarity during the pandemic. We had to make important decisions very quick. So we maybe had to swing more to the directive decision-making for a while, but not to the neglect of dropping the participative decision-making of the people in the field and everyone else that was involved. So that tool can help it come alive for people so they can understand how that energy works, and also how important it is to have action on both sides and to know when you're getting into trouble as well.
There's a couple of things to that. One is when you map things out and you write it down, people see it. It becomes tangible, right? I think to Michelle's point, it's a visibility thing. And then the other thing we do is we walk people through a map. So we'll take a group of people and put them in the quadrants of the map, the positive outcomes, and have them feel the emotion of what that is and what they want, what they desire, what they value. And then also have them step into the negative consequences. What is that like? What does that feel like? And, just kind of walk them through so they can manage these emotions that they have around, understand the dynamic and actually experience it. And I think that also helps them with their learning and helps to embed in them the understanding of what polarities really are and how they need to manage them intentionally.
I think that's a good idea. When you talk about having a diagram or a map, we've seen those useful before. Remember the 4 communication styles where you've got the analyticals, the drivers, the amiables, and the expressives. And, some of them are more inclined to relationships. Others are more inclined to task-oriented. Some are more assertive and some are more reserved. And so you kind of learn about those communication styles. And then other maps that we've seen before is the Johari window. And that's where you try to figure out yourself. You understand your relationship with yourself and others. And there's the things that are shared, the things that are hidden, the things that are blind, and the things that are unknown. So having some type of map like that would really be beneficial to help understand some of the tools and things that are necessary. So I'm sensing here that the relationship dimension of learning and basically exploiting and delivering the value of this type of polarity intelligence is really all about relationships to a certain degree. I think it was Franklin Roosevelt says, if you treat people right, they'll treat you right at least 90% of the time.
Yeah.
So how do you get people to deal with difficult conversations and crucial conversations and go deeper without attacking each other? There's got to be some techniques you've got to make that happen.
Oh yeah, there certainly are. And actually, the podcast that we just did this week was on strong partnerships and relationships. But we actually have 2 different frameworks that we work with healthcare leaders with. One is the dynamic balance effect framework, which is more on a personal level, that personal leadership. But we also have a framework called the Healthy Healing Organization, or H2O framework. And in both of those frameworks, we teach about the principles of dialogue and the principles of healthy relationships. And because it's really important that you don't make assumptions that people know what you're talking about and that you actually create these safe spaces. And for both of them, the first principle is intention and intentionally creating that space to have these difficult conversations and really honoring who we are as human beings, no matter what the situation is. And then really seeing the potential in every individual that is part of that conversation as well. And those are key elements to polarity intelligence, our healthy relationships and dialogue skills as well.
Well, in our programs at the university here, we have our students, our learners, develop a personal leadership philosophy. And the way we start that process, we recognize that we all have our own worldview. That's how you see it, Michelle. That's how you see it, Tracy. This is how I see it. But we have a worldview, and that really shapes our values and our character. And those values and character really shape and formulate our personality. And guess what? Our personality gets demonstrated in our behaviors. So we try to have people sit down and figure out their personal leadership philosophy. I can certainly see where this polarity intelligence would be a component of that leadership philosophy, being able to be aware of that and to work through the details of that. Shifting the topic a little bit higher, away from a very specific element here, just in terms of leadership, what are some of the things that you like to see in healthcare leaders? What are the qualities and things that you like to see? Do any stand out more prominently than others?
Well, this is Michelle. I'll go first. Right now, something that we would like to see in healthcare leaders is that they take the lead on taking care of themselves right now. We know very much so that we're in the middle of this pandemic, and one of the things that Tracy and I've done is we have pivoted to focus on leaders' health and well-being. We see them as the linchpin of the healthcare system, and at the end of the day, if the leaders don't take care of themselves, we're going to have a bigger problem than we've ever had before, right? So to take ownership for that and to not put everybody else before them, but to really step into that space and look at how well am I taking care of myself and how well am I being a role model. And we actually have a podcast coming up soon about how we need to change and we need to blow up the model of leadership, because leaders have been literally sacrificing their time and their energy for this, for the team and for everyone else. So we think the future of leaders, they're really going to be thriving, resilient, unstoppable leaders, and they need to learn the skills and have the support to do that.
It's putting your oxygen mask on first, right? You can't be there and be fully everything that you can be in your personal or your professional life if you're not taking care of yourself. And I think a part of that I'd like to see is have them set boundaries, which kind of aligns with that, right? Really have some very clear boundaries that they can set so that they can honor what they really want in their lives, both professionally and personally. And then I think the other thing is that they work from a place of strengths. Michelle and I are really strong advocates of strength finders and really working from your strengths. And I think when you do that, it really helps to reduce the stress and the tension that you experience. And when you come from that place, there isn't anything you can't handle when you operate from a place of strength and the strengths of others and tapping into those that are around you and the strengths that they have when you're finding you're lacking in a strength that you might need at that time.
Well, I certainly get the sense that what we want from our leaders, we want them to have a high degree of integrity and certainly care for others. We like for them to be accountable as well. And that's your mission there, is to help make these leaders better and stronger. Yeah. I've seen a cartoon, which I like. I talk about it on occasion, but it shows two different groups of people aligned up on a cliff, and they're separated by a large crevice. And they're throwing paper airplanes back and forth to each other. And the caption says, "Couldn't we communicate better if we built a bridge? Couldn't we communicate better if we had more tools, if we had more resources, if we took the time to make it that important?" So thank you very much, Tracy Christopherson and Michelle Troseth. They're incredible podcast out there. Once again, the name for everybody to know, Missing Logic of Healthcare. So thank you, ladies, for being part of our program today.
Thank you.
Thank you for having us.
Thanks for listening to the Business of Healthcare podcast. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu/healthcare.